Welcome everyone. I'll say good morning and good afternoon to those of you that are on the West Coast and those of us that are on the East Coast. As Jen very kindly said, my name is Ruth Golomb. I work in outside of Washington, D.C. and have been involved with the Trichotillomania Learning Center for many years, and I think it's a wonderful organization, and I'm delighted to be here. Today I'm going to be talking about body-focused repetitive behaviors at school and what parents need to know about that. So let's start with defining hair pulling disorder, which is in the DSM-5 now. The criteria has been adjusted a bit. And it reads now that recurrent pulling out of one's own hair resulting in hair loss, repeated attempts to decrease or stop hair pulling causes clinically significant distress or impairment in social, occupational, or other important areas of functioning, and the hair pulling or hair loss is not attributable to other medical conditions, and the hair pulling is not better explained by symptoms of another mental disorder. I'm sure many of you are familiar with this criteria at this point. The criteria, the aspect that's been eliminated is tension prior to pulling. That used to be in the criteria, and also gratification following pulling. That also used to be in the criteria, and that is no longer in the criteria for hair pulling. What has been an addition to the DSM-5, which we are really pleased with, is the addition of excoriation disorder or skin picking. And the skin picking criteria is very similar to the hair pulling criteria: recurrent skin picking resulting in skin lesions, repeated attempts to decrease or stop skin picking. The skin picking causes clinically significant distress or impairment in social, occupational, or other important areas of functioning. The skin picking is not attributable to other psychological effects of a substance, and the skin picking is not better explained by symptoms of another mental disorder. That one criteria is very important, and what that does is that eliminates delusions or hallucinations from other psychotic disorders. It eliminates body dysmorphic disorder as seen as an attempt to improve a perceived defect in the skin, and it also eliminates self-harm, which is causing intentional harm to oneself. Most people who pick their skin will pick their skin in order to achieve a particular result, not to cause harm to themselves. And that way we distinguish skin picking from self-injurious behaviors or cutting. So that's an important distinction. We're very pleased that it has been added to the DSM-5 so that now it is considered a disorder. It has a number that we use when we diagnose clients, and therefore can be reimbursed by insurance companies. So we're really pleased with the addition of skin picking. But we're here today to talk about what happens in school and what we might want to do when you have a child who is hair pulling or skin picking in school, and if and how to include the school in helping your child. So just the basic information. The first thing I want to point out when you're providing information, and this is to school personnel or honestly anybody else, the first thing that you want to do is you want to assume the listener does not know about body-focused repetitive behaviors. That's what BFRB stands for, body-focused repetitive behaviors. And I am going to say, even if the person says they are familiar with it, I still would work under the assumption that they may not know the information that you are going to give them. And also you want to make sure that everybody is working with the same information, and that's why it's really useful to give the information in and have an opportunity to discuss it with the person that you're talking to, so that way everybody's on the same page. When you are giving information, it is really, really important to be clear. Don't use jargon terms, and don't assume the person, again, knows what you're going to say or what you're talking about. And try not to say things along the lines that are too general. That, oh, my child, has this, they pick their skin, and well, the listener probably doesn't know. So be clear when you're giving information specifically about hair pulling or skin picking, so that again, everybody has the same information. Try to be as concise as possible. Too much information is not necessarily welcomed or easily processed. The listener only needs to know the information that they need to know. And being concise can be really helpful. So thinking about it ahead of time, writing down perhaps what you want to say, practicing what you want to say, those things are really important. Give simple information. Use terms that we all are familiar with, and try to be matter of fact. If you are really wrought with emotion and very upset, the listener is going to be very upset with you. And what we want to do is we want to give the listener confidence in the information that we're giving. So be clear, be concise, have simple information. TLC is an excellent source of that information. They do have some pamphlets and brochures that can be helpful in giving information to schools. So keep that in mind, but really you want to think ahead of time about the type of information that you're going to be giving and what it is that you want to say to the school personnel, or again, anybody else. What I'm saying right here really does go for family members and friends as well. It is really helpful to give clear, concise, simple, matter-of-fact information to those people. We also want to give really careful thought and consideration to the different ages, and I'm going to be talking about the different ages of child, the different schools that you might interact with. And your interaction is going to be different depending upon the school personnel, the age of the child, and also the participation of the child. So we really have to think about all of these things when we're thinking about if you're going to inform the school, and what kind of information you're going to give the school. So, questions to consider. Very, very, very important question is, what do you hope to gain by informing the school? So you want to think about, what do you hope the outcome is going to be? Do you want to just inform the school so that the school has the information? Do you want the teacher or teachers to assist your child in any way? Do you want them to supply your child with certain interventions or strategies? Do you want your child to have the ability to leave the classroom if necessary and go to speak with the guidance counselor? What do you hope to gain by informing the school? I have had many situations where I've had families who have just informed the school without specifically asking the school to do anything. And I want to remind everybody that the schools are filled with really well-meaning, caring individuals who want to help your child. If you're going to inform the school that your child has this problem, whether it's hair pulling or skin picking, the school is often going to the teachers will get concerned. and sometimes anxious and want to help. And if you don't tell them what to do, they're going to come up with their own ways to help your child. And that may or may not be useful for you. So you need to really consider what it is that you hope to gain by informing the school. I have had, as I said, situations where a family informed the school, had a very, very bright, high functioning child who was pulling her hair, and she was in a gifted math class. And she was pulling her hair in her gifted math class. And the parents informed the school about the child's hair pulling, and the teacher, very well meaning, without having any more information, felt that the child was pulling because the child was anxious and stressed in her class, and decided to put her into a regular math class that was not gifted. So that way the teacher was hoping to reduce the stress for the child. Unfortunately, what happened was now you have a child who's bright, gifted, and bored in class and continued to hair pull. So changing the academic level of the class without, again, careful consideration is not a useful intervention. We want the child to be academically challenged at their ability and have proper coping skills in order to manage their hair pulling or skin picking in the classroom. So when you inform the school, you need to be clear on what you hope to gain by informing the school, and make sure that you've thought that out ahead of time. In the case that I talked about, the parents had not thought it out ahead of time. They really wanted to inform the school, but really weren't thinking couple of steps ahead, and that's important. I had another situation where a family informed the school about hair pulling, and again, a very well-meaning guidance counselor brought the family information the next day and said, you know, because your child is hair pulling, the next step is going to be, she's going to be cutting. And that is just erroneous information, is inaccurate. I know the guidance counselor meant well, but she clearly did not understand hair pulling at all. And then gave the family very upsetting information, and we needed to do a lot of backpedaling, informing the school, giving the school, particularly this guidance counselor, accurate information. I spent a lot of time answering her questions, reorienting her so that she had accurate information and was able to move forward with this child and future children in a much more productive way. So again, be very conscious of what you hope to gain by informing the school. Secondly, does your child require accommodations? Sometimes accommodations might be helpful. Many times with skin picking and hair pulling, the strategies or interventions you might ask the school to do can be done in a casual manner, and by that I mean that they don't require any accommodations. However, some schools do require it or ask for it, in which case then you have to go through the process of getting your child the accommodations, going through a series of meetings and getting your child the accommodations that you think will be helpful. Again, we want to be a good team member, so we want to have really the strategies or interventions that you're thinking of that will be helpful to the child without posing a lot of extra work on the teacher. So those are things that you clearly want to consider, and sometimes it will require negotiation with the teacher, but think about those things ahead of time. Whom will you inform? In the elementary school, a lot of times it's going to be important to inform the teacher, of course, sometimes the guidance counselor, sometimes both. Middle school, you might inform the guidance counselor, you might inform some teachers, you might inform all the teachers, you might inform an administrator, and in high school, the same considerations need to be made in terms of which teachers, all teachers, some teachers, how are you going to do that? And lastly, and very importantly, how can you help that person? You need to, again, provide them with the information that they need in order to, first of all, answer the questions that they might have, and secondly, have adequate information to be able to help your child. So those are the things that you really want to think about ahead of time prior to going into the school. Now, if you do think you want to inform the school, what we're going to do is we're going to start with the elementary school. And in the elementary school, what you probably want to do is inform the teacher, the person who's got the most contact with your child, and perhaps the guidance counselor. Sometimes you might want to inform both. But those are the two people that are probably going to be the most important at the elementary school age. Then you want to be very, very clear and specific about what you are asking the individual to do in order to help your child. So, for example, if you're going to inform the teacher about your child's, let's say your child is skin picking in school, and you want to inform the teacher about that, you want to give them, again, this clear, concise information about what skin picking is and what skin picking isn't, and that your child is going to be using certain techniques in the classroom to help them not pick at their skin. And those techniques may be as simple as Band-Aids covering their thumbs, maybe Band-Aids covering several fingers. Maybe they need to have something in their hand to pick at rather than their skin, and they have a putty eraser that actually functions like putty, and that can be a good intervention that's used. If you're going to ask the teacher to allow the child to use these particular interventions, then you also want to make sure that you have an ample supply of these interventions. And if you, again, are asking the teacher to supply these interventions for the child, you need to supply them for the teacher. Sometimes what you may ask the teacher to do, using the two interventions that I've just discussed, is you may ask the teacher to have those supplies at her desk, as well as having the child have those supplies in his or her pencil case, so that if the child loses the putty eraser, the teacher can replenish that quickly, or if the child has taken off the Band-Aids or the Band-Aids have fallen off, the teacher can quickly provide Band-Aids in order for the child to reapply them. So those are things that you might want to consider. Other interventions that may be considered, you may consider having the child wear a hat. Sometimes you need, again, special permission for children to wear hats. That's often against school policy. Or a head covering. You may ask for that. You may ask for allowing the child to have a special fiddle toy so that they have something textured in their hands. They may have to, they may ask for frequent breaks so the child can get up, walk around the school, take a deep breath, go to the guidance counselor, and do some relaxation in the guidance counselor's office, come back. Those are all just some ideas, but each idea needs to be specific to your child and your child's unique behaviors. There might be two children who pull their hair, and the interventions that are used would be different depending on the child's need. Also depending on the child's age and what's going on in the school and in the classes. So you really need to pair the intervention with the child's unique need, and then determine whether you can simply send these interventions in with your child, or again, supply the teacher, inform the teacher, and supply the teacher, and give them supplies as well, so that they can help your child use these strategies in the classroom. At the elementary age, the parent is really very involved. The parent is going to provide all of the information to the school. You're going to also gather as many supplies as will be necessary for the teacher, and make sure the teacher has ample supplies. So you will also need to replenish those supplies on a regular basis. You'll also need to communicate with the teachers as needed, and with the elementary school parents, it's often pretty frequently. So you will need to figure out the best way that you can to communicate with your child's teacher. Sometimes that will mean emailing either daily or every few days or once a week, getting information. Sometimes the guidance counselor can be helpful with that. If the teacher doesn't have time to communicate with the parent, then the guidance counselor can gather the information and communicate. But there does need to be a regular communication between the teacher and the parent, so that the parent is aware of whether the child is using the strategies in the classroom, how helpful those strategies are being, and if strategies need to be reevaluated, changed, or replenished. So that in the beginning, the parent does need to have quite a bit of contact with the teacher, and that's where negotiating with the teacher ahead of time as to how what would be the best way to communicate with them? What's the best and easiest way for the teacher? Sometimes the other thing that parents can do is send in a very simple checklist. Again, let's assume it's we're talking about having Band-Aids on and having a putty eraser, that the teacher checks off that Band-Aids were on the fingers and the putty eraser was on, kept in the child's hands today, or that the hat was worn during the day, or that the textured item was used during a test. You know, those things can be put on a checklist. The teacher just checks it off, and the child brings that checklist home. That's another way to communicate with the teachers. But finding good ways to communicate is really important. Important piece of information for parents, really at any age, honestly. I put this under elementary school, but really it's any age, is the parents do need to pay close attention to their own complicated feelings. You know, I know that any parent would give their right arm to help their child really manage these complicated behaviors. But a lot of parents really spend a lot of time very upset about what they perceive the future is going to be for their child. They don't want their child to be made fun of. They don't want their child to feel bad about themselves. And for many, not all, but many elementary school kids, particularly the younger ones tend to not have as complicated feelings about their behaviors as the parent might. So therefore, it's really important to think about who is upset about this the most. Is it your child or is it you? And if you are upset, which you have every reason to be, and it makes perfect sense, you need to pay close attention to that and make sure that you get the help that you need in order to sort out your own feelings, so that you're not projecting those feelings onto your child. I worked with a lovely family, and the child was 5 years old, and the mom spent the first 2 sessions crying in my office, very, very upset, not just because the child was struggling with this behavior, but because she felt her son must feel terrible about himself. And one of the things that we spent a lot of time talking about is a 5-year-old has very different feelings and awarenesses than a parent does. So the parent was very aware of, of what it might be like to grow up and have these behaviors. This child is 5 years old. He has no idea what it would be like to grow up and have this behavior. And he was biting his nails and picking at his cuticles. And it really, it bothered him because his fingers got sore. But that was the only reason that it bothered him. He was 5 years old. He did not have the social awareness to be upset on that level. And it was so important for that mom to really understand that, and understand that this was her concern and not her son's, and that we really needed to hone in on the behavior and also hone in on her feelings, so that so that it did not spread to her son, and we were successfully able to do that. But it is very, very important to pay close attention to your own complicated feelings if they exist. Secondly, we're going to look at middle school. In middle school, there are often a series of teachers. So you want to then consider, are you going to inform the guidance counselor, the school administrator, a teacher, a series of teachers, or no teachers at all? You just want to inform the guidance counselor. You want to, again, be clear on what you hope to gain by giving this information. You want to be clear and specific about what you are asking the individual to do. Sometimes I have parents that will inform the guidance counselor that will say, can you check in with my child during social studies? Because that tends to be when she has the most difficulty. So if you could just peer into the classroom or tap my child on the shoulder, or ask the child to come out for a moment and talk to you, remind her to use the strategies that you've talked about, and then send her back to class, that would be helpful. That's one way of working with a middle school child. Another way, so that's just informing the guidance counselor and not necessarily informing the teachers. Another thing you could do is talk to the child about which classes the child is most likely to pull or pick in. And then you want to discuss the use of strategies in those particular classes, and then whether it would be helpful for the teacher to be informed. Sometimes, again, the teacher might have a supply of strategies in their desks. Again, for middle school, that means that you're going to have to give multiple teachers multiple strategies if that's what you're going to do. Secondly, you also may want if the teacher has a good relationship with the child, the teacher might have a secret signal, like pulling on her ear, or even just tapping the child on the shoulder, which is a reminder for the child to move her hands down, or put her Band-Aids back on, or get the putty eraser into her hands, or use the textured item that's in her desk, pull it out and use it. But they might have a secret signal that would alert the child that she needs to move in this direction. Again, in middle school, you may consider accommodations. That's something that you will need to look at. And if you're going to ask for accommodations, that is going to be a more formal request, and it does require a series of meetings with school personnel. And lastly, but obviously very importantly, you want to consider ahead of time how bullying will be handled. Some schools are absolutely stellar and excellent with regard to this. They think about it themselves. They've already determined what they're going to do. You definitely want to discuss it with the teacher, the guidance counselor, the administrator. Make clear ahead of time what's going to happen. There are different ways of dealing with bullying. Sometimes bullying is done by an individual or a group of individuals that are really just truly not informed. They simply do not understand this behavior, in which case informing the children about this behavior might be helpful. But in addition to that information, they also need to know if the teasing, the inappropriate comments continue, then it will be treated as bullying, and that whatever the county or the school system's rules are for that are going to be employed with this child. So the child or children need to know, first of all, basic information about hair pulling or skin picking, but then they also need to know that that this is considered bullying, and the teasing feels bad. Again, some children really truly don't know that, and informing them of that, helping them understand that. I've seen many times where these kids who have been the biggest teasers become the biggest advocates for the child once they really understand what the circumstances are, and that's a very positive way of dealing with it. There are times where information doesn't help, in which case, again, the laws for bullying or rules for bullying within the school system need to be applied in this situation. Other things that it doesn't rise to the level of bullying, but there you might have a very curious class, or a class that really doesn't understand why a child gets to wear a hat when nobody else does, or gets to have putty eraser when nobody else gets to do that. And sometimes informing the class can be helpful. I've had kids who have taken a health class and decided to do a report on skin picking or hair pulling, and therefore they are providing health-related information, but they're also informing the class about this this issue that they are struggling with at the moment, and it has been very successful. There are other times where kids want the class to be informed, but they do not want to be there while the class is being informed, in which case a parent might be the information giver, or the parent might give the teacher information, and the teacher then dispenses this information to the class, and then the child comes back. And I've had other extraordinary circumstances where the child really does want to give the class information and stands up and presents information about hair pulling or skin picking to the class. And I would say the same thing I do say the same thing to those children. Think about it ahead of time, be concise, be clear, and also consider if there's anything that you think your classmates might do to help you. You want to make sure that you include that in the information that you're giving. So something like, if you ever see me with my hands in my hair, if you just tap me on the shoulder, that would be very helpful. If you smile at me, if you give me some encouragement, those things are very, very helpful. It's really useful to think about what people can do as opposed to just thinking about what you don't want other people to do. So really think about that ahead of time. And lastly, well, sorry, not lastly, the parent in the middle school is somewhat less involved with than with the younger child. You definitely provide concrete, accurate information to school personnel. You might be present during those meetings with school personnel. You need to communicate as needed with the teacher, but for older middle school kids, a lot of times the kids will communicate themselves with the teacher. Sometimes the kids don't want to, in which case you'll need to do that for them if necessary, but many times the kids will want to do that themselves, in which case you just want to make sure that you're communicating with your child and making sure that he or she has the supplies that they need, and that things in the classroom are going as they had hoped they would go. In high school, I don't have a lot written down here because it's very similar to the middle school, although, so I'm going to go back to the idea that for high school, we still want to potentially inform the guidance counselor or administrator. You want to determine which teachers need to be informed if you're going to inform teachers at the high school level. And secondly, remember, at some high schools, they switch teachers every marking period or every semester, in which case you may need to inform the new teachers. And you just have to keep that in your thought processes so that you don't miss a teacher if the child's switching at mid-semester. However, the child really needs to participate in the decision making and how to proceed. The high school student needs to determine whether he or she wants certainly the students to know, whether he or she wants the teachers to know. The student should be able to choose which teachers are informed and how they're informed, and the student should be part of the team, essentially, and be able to really participate pretty fully in this. Now, there are many times where a high school student is not ready to do this, in which case you want to allow the student to not inform the teacher or the schools at that moment. But the child also can change his or her mind. So if a child says in the beginning of school, I don't want to tell any teachers, I don't want to tell the guidance counselor, that's fine. But about 3-4 weeks later, you want to revisit that and say, how are you feeling about that decision? Has anything changed? Do we need to consider informing anybody? And keep those lines of communication open so that the child is allowed to change his or her mind if he or she chooses to do so. It's very important. What you as a parent can do, you can't make those decisions for your child at this point. They need to participate. What you can do is make sure that they have adequate support when necessary for making that decision, and that it's clear that they're not on their own if they don't want to be, that you're there to support them. And that also, if there are other issues going on with your high school students, if they have learning disabilities, if they're stressed because of college prep, SAT prep, college choices, that you are fully participating in those areas and that you're supporting your child where you can. So you really want to pick and choose, but again, your child definitely has to want to participate in the decision making, and it is his or her decision. So that one is not completely in your hands. Focus on the things that you can focus on, like college prep, SATs, those types of things. So that's the conclusion. I hope that gives you a good sense of how you might consider making these important decisions and which school personnel you may contact when you need to contact those school personnel, and also, most importantly, or equally importantly, to seriously consider your own feelings about the process and about what you need to do and how to meet your own needs so that you are not unduly stressed during this period of time.
Thank you, Ruth. Now, again, I encourage everybody, if you have questions, okay, I see that they're starting to come, but type your questions under the questions tab, and I will share them with Ruth. So, Ruth, first question or a point to share. Astrid says, one point to share, consider curricular triggers. Our high school daughter with TRIC was recently given an alternative assignment rather than study the skin and hair system and participate in the pull out a hair and look at it under the microscope lab. It's something we didn't consider when working with the school to create her 504 program.
That's an excellent point, and I've heard that before, and I think that is definitely something you want to consider. It's hard to anticipate that sometimes because you don't necessarily know what the science class is going to have in it, and you also don't know whether your child is going to be triggered by that particular exercise. But if you know ahead of time that that's coming up, it is really useful to have a conversation with your child and say, how do you think you're going to feel about this? And if they feel like that's really going to be a trigger or a difficult spot for them, to have an alternative assignment. Really important.
Okay. One question, Ruth, that came up recently in an email that I received, and I may have even communicated to you about it, was how do you handle this when the behavior, whether the pulling or the picking, is impacting other students in the classroom, especially, say, students seated right next to your child, if they're bothered by the behavior, if they're made uncomfortable by it? How can you handle that kind of a social situation in the school?
It's an excellent question, and it does come up from time to time. And I think one of the things that you want to do is you want to talk to the child who has the body focused repetitive behavior first, and then talk about what types of things those students who are sitting next to him or her might do that would be helpful. So, so that way everybody again will be on the same team essentially, so that the children who are bothered by this behavior will have something that they can do, but it needs to be also helpful for everybody. So something like, again, tapping the child on the shoulder, giving the child an encouraging smile, passing a Band-Aid over, giving the child some textured toy to hold, something along those lines. So you want to consider what will be helpful. I will say if that does not work, and if those things are not useful, you also may want to consider a seat change, either for the children that are bothered by the hair pulling or for the child who's engaging in the behavior themselves, not to isolate them, and that's important not to isolate them, but to put them next to people that maybe aren't bothered by the behavior.
Mhm. Thank you. Okay. Stacy writes, also helpful, thank you. One thing we had to deal with is the school approaching us, not vice versa. Can you talk about being prepared to talk to them when they approach and repeatedly? Thanks.
Sure. Again, I can't overemphasize the fact that the school is filled with very caring individuals. These people care about your child and are concerned. And this is a behavior that they really are not familiar with. They don't know what to do with this behavior. So one of the things that you want to do is you want to help the school by, again, giving them accurate information, and that's where TLC can be helpful. And then secondly, giving them something to do. Even if your child is wearing Band-Aids at school, give the staff Band-Aids so that they have something that they can do, so that they can feel like they're being helpful and they're helping your child. I did have a situation recently where a school approached the parents, and a child was, it's a little elementary school child, and he was pulling his hair. And the teacher came up with an idea where she said that this child had special permission to wear a very special thinking cap, and he wears his thinking cap during class, and that helps him not pull his hair. And that was the teacher's idea, and everybody was on board with that, and that was excellent. Now, teachers don't sometimes have great ideas, and sometimes don't really know what to suggest, and that's why if the school is approaching you, you really want to consider very much what you want the school to do, and you want your child, if your child's old enough, to participate in that decision making, and if your child's not old enough, you want to then consider what it is you want them to do. But basically, if they're repeatedly contacting you, they're probably saying to you, essentially, we're worried, we don't know what to do, we want to help, and saying nothing is making us anxious, essentially.
Thanks. Um, what happens when the high school, oh, this is from Aaron. What happens when the high school student is in complete denial and is still not participating in getting herself help? I've already spoken with the high school to inform them in this case.
That, high school kids are in a tough position developmentally. Developmentally, high schoolers are separating themselves from their parents. They're trying to develop their own independence, their own individual personalities, and coming to grips with this behavior at the same time is really, really, really hard on them. So the high school kids really experience this differently. Every child does. So one of the things you want to do is for the high school child, give the child the room to come around to their own conclusions. Sometimes that might mean having them talk to a therapist. Sometimes that might mean backing off for a little while. Again, could be a month, could be several months, and then checking back in with the high school student and saying, just want to check in, see where things are, see how you're doing, and making it clear that you're open for, first of all, discussion, and secondly, to help them if they wish to be helped. But you can't force help upon a high schooler when they're uninterested, because it is their behavior. It's not anybody else's behavior, and they really have to be on board to some degree. Now, I will say, if they go to a trained therapist who understands body-focused repetitive behaviors, a lot of times that person can help interest the student in therapy. The therapist really understands that there's going to be some ambivalence, that it's difficult for an adolescent to work with their own complicated feelings around this disorder, and they really understand a lot of that, as well as potentially working with a reward system that might help the adolescent be interested in working on these behaviors.
I'll just add too to that that TLC, I'm really aware that there are a lot of kids and adults out there that feel hopeless about ever recovering from BFRBs, and that can obviously contribute a lot to whether or not you have any interest in tackling the problem. Um, if you felt like there was an easy fix, you might be a lot more willing to tackle it than if you feel like nothing you do is going to work. So we really are trying to further improve upon the efforts we've always made to share success stories, to share recovery stories. And if you and your family do have a recovery story, please do contact me, share it with me, because we really want to get those messages out more prominently than, obviously we know can be a frustrating problem and difficult to overcome, but we at TLC know, and I know Ruth knows, that it is actually very possible to have a recovery or a great deal of improvement, and that one doesn't have to feel hopeless. So that
That's a great point, Jen, and I think that that again sort of underscores this idea that even if there are times where I have high school students who come to see me, and they might even just see me for 1 or 2 sessions. They're not quite ready for treatment, but they do hear that there's hope, and that message is really important. And those of us that have worked with students, with children for quite some time, are well aware of the success stories and the progress that people are able to make, and particularly at a young age or adolescent age, there's always hope. And I think that is such an important message. And sometimes, even if you take a child to a therapist, even if it's for a short period of time, if they just get that message of hope, that's really important.
mm-hmm. um, we have a couple of questions that are similar, from one from a middle school parent and one from a high school parent, which basically say the school's on board and willing to accommodate using fiddles and other kinds of tools. But my student is resistant. They're embarrassed. They don't want to be perceived as different. So they're hesitant to use the kinds of tools that have been thought of, I guess. So the one of the questions is what can we do about this? Do you have suggestions for interventions that could be helpful but that might not trigger this sense of embarrassment?
It's a great question, and that's a common question. One of the things that we always want to do is we want to be sensitive to the environments that we're using particular strategies in. So, for example, you might wear gloves at home. You're not going to use gloves in school as an intervention because it's too revealing. However, you might wear, again, Band-Aids on your fingers. You might wear Band-Aids on thumbs. And if kids are curious about why you're wearing Band-Aids on your thumbs, you might say something like, well, I bite my fingernails, or I have a nail infection and I need to wear Band-Aids for a few weeks or a while in order for it to heal. So you don't necessarily have to reveal exactly the reason why you're wearing Band-Aids if you wish that information to remain private. So that you want to use strategies that can allow for that. In that case, you want to use something, again, I'm going to go back to the putty eraser, because it actually is an eraser. And you might just talk about, well, I just really like this cool eraser because it's an art eraser and it works like putty. A lot of times, kids are concerned that other students are going to make fun of them, whereas more often, other kids are intrigued by these really interesting strategies that are being used. And again, the strategies need to be user-friendly in a school. So you might use a particular pen gripper or something that has texture on it. You might have a pen topper that has particular texture on it. You might have, again, the eraser that has an interesting texture to it, but use interventions that other people might use in the schools, but you are to use them specifically for the purpose of helping you keep your hands down on the desk and not up in your hair or picking at your skin. So you want to try to use those particular strategies. And if you have a strategy that's a little bit more revealing, like Band-Aids on the fingers, or a hat or something, then you will want to determine ahead of time what you wish to reveal to your classmates. If you wish to tell them about your hair pulling or skin picking, you certainly can do that. If you want to maintain privacy, you need to come up with a reasonable reason why you're using a hat or band-aids. And again, I had an allergic reaction to something, and and my hair is thinning as a result of it, or my hair fell out because I had an allergic reaction to something. Those are those are excuses that people have used in the past, and also nail biting and skin infection for band-aids.
Great. Another question we've had is, are there any special considerations for athletes? Swim teams, softball, etc., all require head coverings, swim caps, helmets, etc., which can be tough to manage when you're wearing a hairpiece.
Absolutely. Those are great questions, and I think they're the type of thing that you want to talk to your athlete about. You know, how difficult is it? Is this something that we want to inform the coach about? Do you want to have a private dressing area so that you can suit up? You know, putting your helmet on with your hair covering or your hairpiece. You know, you want to consider what you might need in order to be more comfortable. If it's for the team to be informed and therefore you can function more comfortably with the team informed, that's great. If you need to use, again, go into a private stall in the bathroom prior to suiting up, that's fine too. Just determine what you think would be most helpful for you, and then try to figure out, again, who needs to help you achieve that. It could be a teammate, it could be the team captain, it could be the coach. Whatever works best for you, that's where you want to proceed.
Mm-hmm. And this may be age, your answer may be age related here, but one question from Siobhan is, what happens if the child does not wish to tell a certain teacher, but the teacher needs to know because what they teach might trigger the child into pulling? Or I could imagine other reasons a teacher might need to know, in the sense that they're perhaps noticing the behavior or noticing a problem.
Right. It's a tough question. I would say, you know, if a child is old enough, if it's an older high schooler, then what you want to do is you actually want to make sure that the high schooler has the coping skills, the strategies that he or she needs in that class, and that every time they go to, I'm just going to say maybe it's a science class. I'm just saying, but every time they go to that science class, they need to assume that they're going to be triggered. So therefore, they need to have the strategies on or in their hands prior to sitting down and getting settled in the classroom. So it's up to the high schooler to use those strategies in that environment where they are likely to be triggered. So again, if the high schooler is using strategies well, then they can come home and you can talk about it. They can be rewarded for that. They can be rewarded for using the strategies in that environment. If it's a younger child and the teacher needs to know in order to help the child, in order to supply certain strategies, then you may need to just again tell the teacher, and let the teacher know that these are the things that will be helpful to the child. I will say one of the things that is important, we do not want teachers changing what they're going to say or their curriculum because it might trigger hair pulling or skin picking for your child. Your child's coping skills need to be really concrete and useful enough to tolerate